Active fire protection comes into play after your fire started. Passive is obviously there all the time. So it includes the active fire measures include your dampers, sprinkler systems, alarms, which are automatically operated in the event of the fire. So obviously alerts staff to the presence of a fire in the building so they can prepare for potential evacuation. Obviously with sprinklers and suppression systems, they can actually extinguish the fire after it's started. Because obviously one thing we're particularly concerned about, especially, is the passage of smoke. The speed it can travel, it's quite rapid, between 15 and 90 meters a minute. That's a lot of area can be taken over by smoke. And most of the deaths are actually not by fire, but by smoke. The other interesting statistic, really, the number of deaths of people that are not even in the room of origin. So it's traveled through because the passive fire protection is inadequate. And then the other thing is the visibility severely reduced. Obviously that impacts on rescue services and also evacuation. So smoke is one of the things we need to control, and passive fire protection does a good job of that. But does it work? Well, yeah, it does, because this building here recently had fire stopping work carried out on it, and had a fire there. You can see from the inset picture, it's quite an aggressive fire. But actually, if you look to the left of the building, though it doesn't show very clearly, there's actually lights on in that office there. The office is there, so the building's still operational. They haven't had to close down the whole entity as a result of fire, which obviously is what we're looking at, to restrict everything to the minimum amount of damage and keep the maximum amount of operational ability ongoing.
Now, due to the nature of some of the wards and areas we have developed, with some of the suppliers' specialised solutions that comply with the tested evidence, some low fibre content fire stopping products. Now, instead of in traditional rock wall and bat, we can solve using dry lining methodology. And this will provide a low content of fibre particles in the air, which makes cleaning much easier. So in sensitive areas, efficiency is key. So we try to be in and out as quickly as we can. But to do that, access planning and support from our own dedicated site manager to communicate to hospital staff is always vital.
Hilti Document Manager, yes, it's an innovative way to meet passive fire protection traceability and meet our requirements of our third-party accreditation without the admin headache. We use both web-based system and the app system for all of our projects. The web-based portal is used by our admin team in the office, and the app system is used by our on-site operatives. The Hilti Document Manager uses QR codes to log each fix on site. This QR code, when scanned, will bring up all the information about that fix. The report shows a reference location, it shows the size of the breach, it shows the required fire rating for the fix, it shows image numbers, site observation, quantity, and then we triage each one of those breaches, low risk, medium risk, and high risk.
Reducing fire-related incidents. The costs of serious fire in England can be high, and afterwards many businesses do not reopen. In 2008, the costs as a consequence of fire, including property damage, human casualties, and lost business, were estimated at £8.3 billion. Reducing fire-related risk is possible. Maintaining compliance and improving existing building safety is the challenge. These figures show the importance of excellent fire safety management policies and procedures, with integrated working partnerships and live reporting systems, as fire and rescue services have seen a 30% reduction in the number of fire safety audits and inspections between 2010 and 2015. This really hasn't improved and is still a struggle due to a severe lack of resource across fire and rescue service. So there was reduced capacity within the building on that particular day. As it states below, the critical care unit filled with smoke within 4 to 5 minutes of the start of the fire, and was one of the first areas to be evacuated. Straight away, there obviously was an issue with compartmentation. And if you notice below, the incident evolved so rapidly that staff did not have a chance to formally declare a major incident until after the evacuation had been completed. That's where the main challenge lies outside of building fire safety compliance under the Regulatory Reform Order, Fire Safety 2005, and all subsequent new legislation, which includes the Fire Safety Bill and the Building Safety Programme, which many within the fire safety sector will eagerly await its launch and to see if it actually will make a huge difference. You know, we can only hope that this worthy tool works for all parties.